Assembly Member Garbett now, and the question is learning from Europe about drug harm reduction.
Thanks for your question. We know that the illegal drugs trade causes huge damage to our society. The drugs market itself is estimated to total £9.4 billion a year in England and Wales alone, whilst Dame Carol Black's independent review of drugs found the health, harm, cost of crime and impacts on wider society to total more than double that, at £19 billion a year. Partnership working is key to tackling the harms caused by drugs. That's why I've invested in interventions that take a more holistic approach to drug harm, such as investing £8 million in Project ADDA, which uses partnerships to addressing drug misuse in local communities. The programme builds on learning from other areas of England, where this approach was first piloted, including Blackpool and Hastings. It focuses on coordinated law enforcement activity alongside diversionary programmes using the criminal justice system to divert people away from offending. Our funding has enabled the rollout of Project ADDA across London. Other European cities are looking at adopting similar policies that see a public health-focused lens applied to harm reduction. These policies are aimed not only at safeguarding public health and human dignity, but also at fostering social justice. We established the London Drugs Forum to tackle drug harms across London. The forum takes a public health approach to drugs use and offending and recognises that tackling these harms requires whole system solutions. Enforcement agencies alone cannot address all the factors involved. The forum continues to hear from a range of stakeholders on best practice, both nationally and internationally. I understand that Member Garbett was invited to observe the London Drugs Forum discussions on drug consumption rooms in November. As part of this, the forum heard about 200+ drug consumption rooms globally in 17 countries, including 11 European countries such as the Netherlands, France, Spain and Germany, and the benefits and challenges of implementing this approach. Drug check-in and testing services, which can improve knowledge about risk and facilitate harm reduction messaging and conversation with drug users, have also been discussed at the London Drugs Forum, as these have been widely adopted in Europe and are currently operated in Bristol, Manchester and London. The forum will continue to have discussions with experts and multi-agency partners on the strategic challenges and practices needed to effectively address drugs harm in London.
Thank you, Mr. Mayor. So 2 weeks ago, I took the train to Warsaw. I was invited by the Mayor of Amsterdam to take part in her Dealing with Drugs conference too. I don't know if you know, but the Mayor of Amsterdam regularly supports regulation of drugs and talks about it frequently, and it's absolutely inspiring to see her speak about that. So I spoke alongside the Mayor of Amsterdam, the Mayor of Brussels, the former Mayor of Prague, who are whistleblowing on this health crisis. We also heard from the UN Commissioner for Human Rights, who I thought you'd be interested to hear from, given your background in human rights, who said that the evidence is clear and the so-called war on drugs has failed completely and utterly, and drug policies that prioritise health and human rights are more effective and more humane. So it'd be great to have you as part of these conversations. So I wondered if you'd join these leaders across Europe and globally in talking about reducing drug harm.
Thanks, Chair. I'm a friend of the Mayor of Amsterdam. She's a great mayor, and I'm more than happy to talk about the dangers of drug harm. I'm more than happy to talk about the importance of diversion. Some of the work the London Drugs Forum doing is incredibly important. She's seen some of the pioneering stuff that's been undertaken within the parameters of the law. What we don't want is those who work in this area to inadvertently break the law, which is really important. I've got examples of international practice across the globe. Some has worked, some less so. But the status quo isn't working in relation to, I mentioned the financial cost of this, and she'll be aware some of the work the Drugs Commission is doing in relation to cannabis and the dangers that poses and so forth. So it is really important for us to have this conversation in a public forum to have these issues raised.
Brilliant, because it would be great for you to be speaking about that on a national level, because the focus on the conference was all about cities and the unique challenges that cities face. So the more that you can be doing to champion the change needed for London and the problems we're facing here, it would be, great to do that. The question I wanted to ask you is to understand how connected you are and how much you're hearing from people who are most affected by our dangerous drug laws. So the people who've lost family members. So there's a group called Anyone's Child, and it's parents and partners who've lost friends and family to the war on drugs. They talk really passionately about the need for drug reform, and I just wondered if this is a group that you'd be up for meeting with.
I'm not sure if I understand the victims of war on drugs. I'm not sure.
So they're people whose partners and children have died from drug use. A lot of them talk about the fact that the stigma related to drug use is the cause of their drug death, and the fact that they didn't have access to health treatment, or the fact that drugs are available in the way that they are and not through health professionals. So they are linked to the organisation Transform, which I know you're aware of, but it's a group of parents and family members who talk about their experiences of their children and of their partners. And I just wondered if it's a group you'd be up for meeting.
Chair, more than happy for Kaya and Tom, who co-chaired the London Drugs Forum, to meet with the various groups and invite them along to a London Drugs Forum meeting to have those conversations, because those voices should be heard.
It'd be great if you could meet with them as well. I'm sure they'd like to hear from you as well, but I do welcome the opportunity for them to go to the Drugs Forum. And just on cannabis, so you mentioned earlier the Drug Commission. You said to me in July that you'd be disappointed if it wasn't out by the end of the year, which we know is about 12 days' time. And I'm concerned to read in the Police and Crime Plan, it says it might be here in the term of the Police and Crime Plan, which is obviously up to 2029. So I just wondered if the Drug Commission is going to be out soon.
I am disappointed, and it'll be out next year.
Okay, thank you. And Merry Christmas to you and your family.
And to you as well. Thanks, Zoe.
In conclusion, this discussion clearly highlights a growing realization that the traditional war on drugs approach has failed to deliver results. Both the London Assembly member and the Mayor emphasized the importance of adopting a public health perspective rather than a purely criminal one. London's efforts, such as Project Adder and the London Drugs Forum, show a shift toward evidence-based harm reduction strategies inspired by successful European models. The dialogue also underlines the need to include families affected by drug-related deaths in shaping future policies. Overall, the conversation reflects a strong call for compassion, collaboration, and reform in how society deals with drug misuse. Do you think London should follow European countries by introducing safe drug consumption rooms and health-based harm reduction policies? How important do you believe it is to involve victims' families and advocacy groups in shaping future drug laws and policies? Let us know your thoughts in the comments below. Don't forget to like this video, subscribe to our channel for more in-depth political commentary, and hit that notification bell so you don't miss our next deep dive into the world of power and politics. Thanks for watching.